Righty. Hello, everyone, and good afternoon. Thank you for joining us for our virtual open enrollment seminar. At this time, we will go over Kaiser Permanente medical benefits for plan year 2026. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the chat box located on the right-hand side of your presentation screen. Be informed that if you type a question in the chat box, everyone attending the session will see your question and your name. We do encourage that if you have a question that is sensitive or confidential in nature, we recommend and encourage you to reach out to the County Benefits Division or your department's benefits ambassador. Lastly, today's seminar is being recorded. A copy will be posted on the Benefits Open Enrollment website and will also include a copy of the slide deck. At this time, I will turn it over to our presenter, Myra Chavez.
Thank you very much. Good afternoon, everyone. My name is Mayra Chavez with Kaiser Permanente. My goal today is to provide an overview of Kaiser Permanente, our integrated care model, our tech capabilities. We'll also be going over your benefit options so that when it is time for you to make your healthcare decisions, you have the information that you need to make an educated decision. Now, Kaiser Permanente provides high quality care for all that is you. So your physical, mental health, whether you need care for your routine checkups, complex treatments with specialists, and your mental health wellness. At Kaiser Permanente, our priority is that our members receive excellent care when and where you need it. Now, this QR code on the screen will take you to kp.org/choose-KP to learn additional information on Kaiser Permanente. Now, with Kaiser Permanente, your doctors, hospitals, and your health plan work together to provide a seamless experience when and where you need it. You being the member, your care is around you. So everything is connected. And whether you get in-person care, virtual care, you're able to access your medical record as well as your doctors. So it's easy for your providers to pick up where you left off. There's no repeating your stories. Now, there's 24/7 access to care wherever you are. Like I mentioned, whether you need virtual or video visits, phone visits, or in-person appointments, you're able to choose how, when, and where you access care. Now, a big takeaway, if anything, I'd like our members to be encouraged to register on kp.org and download the KP app. Now, through these portals, kp.org and the KP app, you're able to stay on top of your care 24/7. Now, if you prefer an in-person visit, there's same day, next day, and weekend appointments at most of our locations, and most of our facilities will also have labs and pharmacies in that same building. All right. So next, I'd like to play a little video on Kaiser Permanente and the benefits of having access to care at your fingertips. Now, if you're not already registered on kp.org, all you need is your member ID number to register. Once you choose the sign in option, it'll prompt you to plug in your medical record number, first and last name, along with additional personal information. And then once registered, you have access to all of the capabilities that kp.org and the KP app have to offer. Here we see lots of capabilities that the KP app and kp.org have. So you would simply sign in to kp.org or the KP app to access your virtual care on demand, so our 24/7 Get Care Now feature. You can also make your appointments, order your prescriptions, review your medical records, including your lab results, your after visit summaries, the doctor's notes. You're also able to receive personalized care advice for certain conditions through our e-visit capability. So you would plug in, any symptom that you might be feeling, and then it'll give you personalized advice on how to access care or what type of care would be appropriate. Additionally, because we are the health plan and also the healthcare provider, you have one platform to manage all of your care. So you are able to both manage your care and your coverage through the same platform. You do not have to sign on to a different platform to pay your bills or view your statements, and then a separate one for scheduling your appointments and viewing your lab results, right? So it's a comprehensive platform that makes it easy for our members to access care at your fingertips. Now, I'd like to go a little over your telehealth services. So, our telehealth capabilities are provided by Kaiser Permanente physicians. So, your telehealth physician will have access to the same medical record that your primary care doctor has, that your pharmacy has, so that if you do need to follow up with your primary care doctor, it's already logged into your medical record. If you need, for example, a prescription from this televisit, if it's necessary or appropriate, your telehealth clinician will send a prescription over to your nearest 24-hour Kaiser Permanente pharmacy. And then again, that same integrated care system is utilized. So it gives that seamless experience for our members without having to request records to and from your providers. Now, when you need care, you can talk to a clinician in person, by email, over the phone, or video. So if you do prefer in-person visit, you can schedule an appointment through your KP app or over the phone, making it easy for you to access care. Now, our mail order pharmacy option is beneficial for our members to receive most prescriptions via mail without having to travel to your pharmacy. It's easy to do it at your fingertips, so take advantage of that mail order pharmacy. For some new prescriptions, you can also have same day pickup or delivery, which is very convenient. Now, I'll touch really quickly on care while traveling. I do have a nice slide at the end that goes over all of the features and benefits of care while traveling. But high-level overview, our members have the peace of mind to know that you are covered for urgent and emergency anywhere in the world. Now, if you do plan on traveling, we have a dedicated 24/7 care away from home travel line that can help you plan for those trips. So if you're traveling to a destination where maybe certain vaccinations are recommended, they can guide you through that. Maybe seeing if you have prescriptions that are eligible for early refill. maybe you need in-person care while you're away from home, they can guide you on where to access care. So lots of resources for our members to be able to stay healthy while away from home. Now, Kaiser Permanente is known for catching potential problems early due to our preventative screening rates. So, Kaiser Permanente is big on preventative care, and our clinicians are empowered to provide care in that way. So, they want you to stay healthy so that issues are either caught right on time or they're able to be managed easier. Now, if you do have a condition that does need more attention, know that at Kaiser Permanente you have top-notch doctors across a wide range of specialties. We do have one of the largest multi-specialty groups in the country. So know that you do have access to all of the specialty care that you need. Now, two statistics that we'd like to share. Because of our preventative care measures, 33% of individuals are more likely to survive heart disease, and 20% of individuals are less likely to die early of cancer. So those are some statistics on our healthcare outcomes. Now, having a baby or pregnancy in general is a unique and special experience for each individual. Now, at Kaiser Permanente, your dedicated prenatal team will help keep you and your baby healthy and really empower you to make decisions. So you are able to add a midwife to your team as well. You're able to also create a personalized birth plan. We have a neat feature on kp.org/maternity where you're able to view a template on birth plans, and you're able to, map out or kind of think about how you'd want to envision that day so that you have a safe, positive experience. And then know that care does not stop at delivery. So there is breastfeeding, consultation, lactation support, as well as additional guidance to help you and your baby thrive after delivery. Now, as we know, good health goes beyond the doctor's office. Now, with Kaiser Permanente, we do offer a wide range of support to help our mind and body so that we're able to have a healthy lifestyle and stay healthy beyond the doctor's office. Now, to support mental health and emotional health, we have platforms that are available at no cost to our members. So we have the Calm app and Headspace Care. Both are platforms that support mental health and well-being. The first one being the Calm app. This one is one of the more popular ones that we see commercials about the Calm app. This is a meditation app, but it goes beyond that. So there's guided meditations, daily stretch videos, as well as sleep stories, lullabies, and then beyond that sleep aspect, there's also soundscapes for concentration and just being in a healthy mind space. And so to access these platforms, you would log in to kp.org, so make sure you're registered on kp.org. And under the Health and Wellness tab, you'll scroll down to the mental health apps portion, and you'll see a Calm app option. You'll click the link to follow into the Calm website. Once you're on that website, you'll create your account, and then you're able to download the app as you would any app and sign in using those same credentials. Now, it's important that you follow the app or the link from kp.org because it will link that you are a KP member and you get granted that free access. Now, as a Kaiser Permanente member, you have free access to the premium version of the Calm app. So make sure that you follow that link from kp.org. So from your browser versus the app. kp.org on your browser, under the Health and Wellness tab, you'll scroll down and then you'll see the link to follow to get into the Calm website. Next, we have the Headspace Care app. Now, Headspace is a text-based emotional support coaching app where our members get one-on-one support from an emotional wellness coach for 90 consecutive days a year. And these wellness coaches are available 24/7 via text. So again, 90 days a year, so 90 consecutive days, and you're able to access these wellness coaches 24/7 via text. So much like we have our phone for, pretty much anything, Googling a quick question or social media, whatever it may be that we're on our phone for, our members have access to, getting that guidance to manage complicated emotions. Maybe we are, going through relationship issues. Maybe we're having family disagreements. Maybe we have increased stress. And we want to provide or to receive guidance on how to navigate those complicated big emotions. That's what these wellness coaches are there for. This would not be appropriate for crisis moments, but for our day-to-day challenges where maybe you want to, receive advice from someone that's non-biased, right? You're able to do so through the Headspace Care app. Again, it's discreet, it's text-based, so much like we do anything else on our phone, our members are able to access that guidance. Same way to access Headspace Care, you would go to the Health and Wellness tab on kp.org, follow the link to Headspace Care, and create your account that way. Once your account is created, you're able to download the app onto your smart device and log in with those same credentials. Now, for physical fitness and lifestyle, you can choose from a large variety of classes that are offered in person and online. Some classes are at a fee, while others are at no cost. Now, we also have wellness coaching by phone. Now, this is a program where our very own wellness coaches, Kaiser Permanente wellness coaches, help our members set and maintain long-term healthy habits. Now, this is a resource that maybe is not as talked about by our members or utilized, but it is a very great program. I've used it myself. I'll give a personal example. I could not find the motivation to stay active. Like I knew I needed to work out. I knew it was good for me to stay healthy, good for my body, for my mind, but I could not find the motivation to stay active long term. Now, our wellness coaches came in. I called, I scheduled an appointment. The first intake appointment is maybe like 20 minutes where they, see where you're at and they're able to help you make realistic goals so that you can maintain them long term. And then based on the plan with your coach, they'll check in weekly, bi-weekly, depending on, again, the goals that you and your coach set. And they check in on you just to see how you're doing, how you're progressing, if you need to adjust anything with your goals. So again, this is a free resource, and our wellness coaches are able to help our members set and maintain healthy habits. So maybe we want to get more active, like the way I accessed wellness coaching by phone. So maybe you want to find that motivation to work out more. Maybe we want to reduce our smoking. Maybe we want to learn how to manage our stress better. So for different reasons, you're able to access our wellness coaches, and this is at no additional cost to you. Um, so take advantage. Wellness coaching by phone. This is directly from a Kaiser Permanente wellness coach. It's not another app. Now, to further support lifestyle healthy habits, we also have the One Pass Select Affinity program. Now, starting January 1st, 2025, our partnership with the One Pass Select Affinity program began. And what this offers our members is flexible choice to have in-person gym memberships. Now there's 5 tiers, 5 membership tiers, each with different monthly fees, and each tier has different networks that you're able to access for gyms. Now, the One Pass Select Affinity program offers our members flexibility and more choice. So in this next slide here, you'll see your tiers. So starting with the digital tier all the way up to the elite tier, you have different features and benefits of each. And each will have a different network of gyms that you're able to access. Now, a neat feature about the One Pass Select Affinity program is that you're able to choose or change your tier month by month. So that it's not a contract, it's very flexible. So say you are enrolled in the premium tier, for example. You use some of the boutique gyms or boutique studios, and that's why you have the premium tier. Now, say you're going to be away from home for 2 weeks, right? You're going to be gone for the majority of the month, and you won't be using um, your gym membership as much. You can downgrade to the classic tier or the digital tier for that month, and then upon your return for the following month, you're able to go back to the premium tier. So it offers a lot of flexibility. And with these memberships, so classic, standard, premium, and elite, you also have free Walmart Plus and shipped grocery delivery. So this is a great benefit. I know a lot of the time with our busy day-to-day lives, sometimes we have to choose between going to the grocery store so that we can cook up dinner after work, or make time to go to the gym. Now, with these memberships, our members are able to, order their groceries on Walmart Plus or shipped, and then at the same time be at the gym. By the time they're back, their groceries are at their door. So lots of features and benefits with the One Pass Select Affinity program. If you are interested in this discounted gym membership program, you would do the same as the other platforms. So log into kp.org. Under the Health and Wellness tab, you would scroll down to Fitness Deals and then follow the link to the One Pass platform. Then that way you're able to register and choose your plan. All right, now going over your benefits. Now we have 3 plan options this year, 2 of which are the same. You have your traditional and your high deductible plan. So I'll provide just a high level overview of the plans that you've seen, giving you, your overview of how the plan design works. And then we'll spend a little bit more time on the new addition, which is the Everyday Care Plan. Now, with your traditional HMO, this plan has no deductible, meaning all of your services are on a co-pay structure, and your maximum out-of-pocket is $1,500 for the individual, and $3,000 for the family. So what contributes towards your maximum out-of-pocket? Those are going to be your copays. Copays that you pay for your services start accumulating towards your maximum out-of-pocket costs. And then if and when you meet your maximum out-of-pocket cost, your plan will cover you at 100% for the remainder of the year for covered medical services. Now, your preventative care with any of the plans, you have preventative care covered at no cost to you. So if you are an individual who says, I'm very healthy, I stay out of urgent care, I stay out of the hospital, I have, my coverage for if I need it, right? There's those individuals that are, very lucky in that way that they stay out of out of the medical office, which is great. But again, preventative care is key to catching things before they become a big issue. So with your plans, it's covered at no cost. So your yearly physical, well woman exams, and then if you have littles, well baby exams are covered under preventative care. And that includes preventative labs as well. Now, this is a great way to make sure that, everything continues in that way. So if you're a pretty healthy individual, just making sure that everything stays that way, and you're able to not worry or not have to think like, oh, well, I don't know how my A1C is, for example. You're able to stay on top of that and continue on in your healthy lifestyle. Now, one thing I would like to highlight is the mail order option. Now, with your traditional HMO plan, you have your mail order option of up to you receive a 100-day supply for maintenance medication. So this is going to be medication that we take on a daily basis, maybe cholesterol medication or maybe high blood pressure medication, something to that you take on a daily basis. Most of these medications are going to be eligible for the mail order option. Now, the benefit of the mail order option, as you see here, your copays. So you pay 2 copays for receiving up to a 100-day supply. So that's a 3-month supply with only paying 2 copays. So you save a copay. You also save time because you will not have to go to your Kaiser Permanente pharmacy. It gets mailed directly to you. So 2 benefits of that: you save time, you save money. So if you do have those eligible prescriptions, take advantage of that feature, and you can order those through your KP app. All right. So we went over your traditional plan. It's a easy, simple plan design where all of your services are on a copay structure. Next, we have your high deductible plan. Now, how a high deductible plan works is that all of your services, excluding preventative care, are subject to the deductible. Okay. Now, with this plan, the individual deductible is $1,700, and then $3,400 for each individual in the family, $3,400 for the family, and then your maximum out-of-pocket cost is $3,400 for the individual and $6,800 for the family. Now, for all of these services, you'll see here you have a 10% coinsurance after your plan deductible. So when accessing routine follow-up care, your lab tests and radiology, outpatient surgery, hospitalization, emergency care, for all of your services, you would first be contributing towards that deductible. So you'll pay 100% of the cost until you meet your deductible, which is $1,700 if you're employee only. Now, once you meet your deductible, you would then have a 10% coinsurance. So depending on the service that you receive, would determine what that 10% cost is. And then you would be paying your coinsurance up until you hit your out-of-pocket max for the year. Now, again, if and when you hit your out-of-pocket max for the year, your plan will cover you at 100% for covered medical services for the remainder of the year. Now, note here that with this high deductible plan, you do have your preventative care covered at no cost, like I previously mentioned, and then also different from your traditional plan, telephone and video visits are subject to the deductible. So there's no cost to these services after you meet your deductible. So note those differences. All right, now going into your new everyday care plan. Now, it's great to have options, right? Now, who would benefit maybe from an everyday care plan? Um, you know, first thing is this is based on personal choice, so you would determine whether or not it's a good plan for you. But for someone who maybe wants predictable cost for routine care with still having the benefit of a deductible plan, this might be a great option, right? So going over your plan design. With the everyday care plan, you have a yearly deductible of $2,000 for the individual and $4,000 for the family. With your maximum yearly out-of-pocket cost, it's $2,000 for the individual and $4,000 for the family. Now, how this plan works. Where you see here through your plan design outline, a lot of the services are not impacted by the deductible. Okay, so for example, doctor's office visits. That's like a follow-up with your primary care doctor. Maybe you see a specialist. That's a $10 copay. Plan deductible does not apply. Again, your phone and video visits are covered at no cost. Plan deductible does not apply. Lab tests and most x-rays are $10 per encounter for lab tests, $50 per encounter for most x-rays. Plan deductible does not apply. Now, you want to know when that deductible comes into play, right? So when you start looking at your major hospital services, so outpatient surgery, inpatient hospitalization, for those two services, there's no charge after your plan deductible, meaning for those types of services, you must first fulfill your deductible, and then it's covered at no cost. So when looking at your plan options, you want to see, what services you access, how you utilize your plan. This might be a great option if you, for example, have no complex hospitalizations recently, and you say, well, this is a great option. I want the benefit of that deductible plan, but I want predictable costs for my routine care. This is a great option. It's a very rich plan design, and again, you just want to make sure that you see what fits best for you and your family. Now, going over your prescriptions, for up to a 30-day supply, you have a $10 copay for your generic, $50 copay for your brand name, and $250 copay for your specialty. Note that plan deductible does not apply for your prescription, so that's also a difference from your high deductible plan. You also get the benefit of your mail order option, paying that 2 copays for up to a 3-month supply. And again, if you have any questions about the plans or in general, you can put them in the chat. At the end, we can go over those questions. And then I also have Marcia here with Kaiser Permanente that's answering in the chat as well. Now, choosing a health plan is a big decision, and you don't have to make that alone. Now, if you do have additional questions later on that would help you make an informed decision, we do have a Kaiser Permanente enrollment specialist line at the number listed on the screen. You can also scan the QR code that will take you to kp.org/choose-KP to find additional information on Kaiser Permanente and how our integrated care model supports our members. Now, some service area updates. Now, it wouldn't be a Kaiser Permanente presentation if we didn't talk about, some of our recent accolades. In 2024, Kaiser Permanente led the state as a top performer in 105 effectiveness data measures. Now, some of the measures across California included prevention and screening, comprehensive diabetes care, cardiovascular care, mental health, maternity care, and respiratory care. And I think this just drives home the point of our providers and them being empowered to practice medicine in a preventative manner. So catching things before they become an issue. And if and when you do need specialty care for complex conditions, you have guided support throughout that journey. So, for example, if you are diagnosed with a chronic condition, you are automatically enrolled into care coordination, where a care coordinator will follow up with you. In between your follow-up visits with your doctor, you will have a care coordinator that's following up with you to make sure that everything is going well with your medication. And if there's any issues, you're able to, follow up before that next follow-up visit. So again, that just really puts forth that point of our providers and the importance of preventative care. Now, some updates in Southern California. We do have a few updates. So there are a few expansions as well as some new clinics coming in. So these are more for the like North County area if you receive care towards like Menifee, Riverside, or if you do need to access care, maybe you have some kids that are at school away from home. So know that there are some additional medical offices and expansions coming soon in Southern California. This gives you an overview, a snapshot of your convenient Southern California location. So this gives you a snapshot of San Diego County, Inland Empire, Kern County, Orange County, and LA. So know that, wherever you are, you're able to access services. Now, another way of accessing care, if you're not already familiar, we do have target clinics. So here in San Diego County, you'll see on the right side, on the right lower side of the list, you'll see your San Diego County target clinic locations. Now, this is a very convenient way of accessing care in a quick manner, to say the least. Now, it's easy to get an appointment at your target clinics. Maybe you have a child who needs a school physical. Maybe you have a sinus issue that is bugging you, right? You're able to schedule a target clinic appointment, get seen with a Kaiser Permanente clinician, and the clinic site is equipped with the same integrated care system, the same medical record system as your Kaiser Permanente medical office buildings and hospitals. So know that whatever gets logged into that target clinic appointment, your doctor has access to, your pharmacy has access to. Now, speaking of pharmacy, if you have a Target clinic appointment or visit, and maybe a prescription is necessary following this appointment, you're able to fill that first prescription at the CVS clinic that's there at the Target pharmacy. So very convenient. You won't need to go to this Target clinic appointment and then go pick up prescription at your KP location. You're able to use that pharmacy to fill your prescription. Now, if it becomes an ongoing prescription, anything after that first fill at the pharmacy, then you would fill at your KP pharmacy. So take advantage. Target clinics, easy way to access care for non-urgent things. Now, updates in Northern California. Again, maybe you have some students that live in Northern California. There are some locations that are coming soon. So we do have some Modesto, Fresno locations that are set to open later this year and early 2026. And then some recently opened locations up in Northern California, Santa Rosa, Salinas, and San Francisco. This gives you a snapshot of your Northern California locations. And now let's talk about care away from home. So this is one of the big questions, right? How to access care when you are outside of your Kaiser Permanente region. Now, like I mentioned, our members have the peace of mind to know that they're covered for urgent and emergency care anywhere in the world. Now, there are a few components to care away from home. The first one being international, so across borders or overseas. Now, there will not be a direct billing method with Kaiser Permanente, so you would be paying for services out of pocket in those instances. Again, this is urgent and emergency only. And then upon your return, you would file a reimbursement claim, and you would be reimbursed minus your regular copay or coinsurance, depending on the service, so whether it be urgent or emergency. Now, within the United States, our members have a few more options. Now, across the nation, you're able to access your telehealth capabilities, so your same telehealth capabilities. So that's a convenient way to stay connected with Kaiser Permanente wherever you are. Now, if you visit any other Kaiser Permanente region, so on the map here you'll see that the blue states, those are where Kaiser Permanente operates. Now, when you visit any other KP region, you will have access to care at those sites. You will just be requesting a visiting member ID, and you can do so on the KP app, or you can call the travel line to request a visiting member ID, and then you would access care as you normally would. Now, if you are outside of a Kaiser Permanente region, so pretty much the rest of the gray areas in this map, you have many options. So first off, you have access to the Cigna PPO network of providers. Again, I want to emphasize that this is for urgent and emergency care only. So when accessing care through the Cigna PPO network of providers, you're going to pay your same copay or coinsurance as you would at a Kaiser Permanente facility. There's no need to file a reimbursement claim. Now, additionally, you also have access to Concentra Urgent Cares, Minute Clinics, including their pharmacies, and the Little Clinics, including their pharmacies. When accessing care within any of these networks, again, you pay your same copay or your same coinsurance that you would at a KP facility. So it gives our members peace of mind to know that you're able to access in-person care for urgent and emergent situations. In a life or limb-threatening emergency, you just get to the nearest emergency room, regardless of the network. And I believe that is all. Yeah. That's all I have as far as the presentation goes. So today we reviewed our integrated care model, so how our integrated care model really supports our members and their healthcare outcomes. We reviewed our tech capabilities, so how to access kp.org and the KP app and what you're able to do within those platforms. We also went over wellness resources, so ways that our members are able to stay healthy beyond the doctor's office. And then we also reviewed your benefits. So we went over your traditional HMO, your high deductible plan, and then we reviewed your new everyday care plan and the features and benefits of that plan. Lastly, we closed out with some updates with Southern California, Northern California, and then your care away from home features. Now, I don't know if there's any questions that we still have to answer.
Yeah, so I think we'll address this one with the voice. I think by typing it, I think it'll take me too long. So would it be fair to say a family with serious medical ailments would benefit from deductibles versus the traditional HMO? So it really depends on the family because you really need to look at what the cost is from your paycheck, so your premium you're paying for that actual plan, and how much you would want to pay out of pocket when you access care. So with the traditional plan, you have the low co-payments. So you may be paying a higher premium out of your paycheck for that particular plan, but you have the peace of mind of knowing that you don't have to come up with a high amount of money up front to receive services. So yeah, so you want to look at that. With the high deductible health plan, it might be better for someone who maybe is a little bit healthier and doesn't really access care much. As Myra had mentioned earlier, doesn't really go to the hospital, urgent care, maybe gets their preventative services taken care of every year. This would be a great plan because they're not paying anything for their preventative services. However, if they need to access care, they would need to pay 100% of their services until they reach that deductible. And then once they reach the deductible, then they pay 10% coinsurance until they reach the out-of-pocket maximum of $3,400 as an individual. So if someone's pretty healthy and you're not really using the plan, you can take advantage of this one because you can use the money in the HSA, which is like a savings account, to build for retirement. So this HSA can be used for premiums, could be used to pay co-payments, could be used for dental, vision, for services that, if should you have an emergency and you're building up that fund, you can access those funds for those offsets that you may need throughout, the year or whatnot. So someone that's pretty good for savings and wants to invest into the HSA, this would be a great plan. If we look at the everyday care plan, you access care, but you really are never going to be hospitalized. You're not really planning to have a baby. You don't have any outpatient procedures coming out in the next year that you've planned for or know about. But you do access care, so you need to go in to see your doctor, maybe have a chronic condition, high blood pressure, diabetes, any other chronic condition where you access care on a day-to-day basis. Well, you have $10 copayments to access those services. Your premium from your paycheck is moderate, so it's right in between it's not as high as the HMO, the traditional HMO, and it's not as low as the high deductible HSA. So it's right in between. So, you can still access care. You can, what you're going to pay up front for those services. You have a $10 copayment for most services, $50 if you get any x-rays, $500 if you need like MRI or CAT scan, PET scan, but those, are really rare. Emergency care, you have a flat copayment, so you don't have to worry about a deductible. So only if you're going to have like a surgery or hospitalization would you be subject to that deductible. So it just really depends on the family, what your needs are, how much care you access, what your funds look like. Are you gonna are you a pretty good saver? So you can save money and use that money for an emergency or a situation where you might need care. So really, it's an individual choice. So let me see if I missed any other questions. Do any Kaiser Permanente plans offer any fertility coverage in 2026? So all our plans will be following the SB 729. We are still waiting on direction from the Department of Managed Healthcare and the CDI, so the Department of Insurance, but Consumer, I can't remember what the C stands for. But yeah, so we're still waiting on them. They have until 12/31/2025 to let us know how we are to implement these fertility coverage. But yes, we are going to be following it. So all Kaiser plans will be offering those fertility services based on the DAMHC and how they interpret the SB 729 law. Is dermatology covered with insurance, and how much do you pay? Yes, dermatology is covered, so it just depends on the plan that you choose. It's considered a specialty, so you'd pay the office visit copay. In this case, that we're looking at, the everyday care plan would be a $10 copayment should you be referred to dermatology. And yes, you do need a referral to be seen in dermatology. But just go to your primary care doctor, let them know the situation. If they feel like you need to be seen by a dermatologist, by all means, they will refer you. So I've been in Kaiser for over 9 years. It doesn't have a yearly deductible, so I'd say it's HMO least expensive. Yeah, HMO does not have the deductible. I don't know anything about dental. Get the PPO. Okay, so that's dental. What phone number to call learn when enrolling a Medicare Advantage plan with Kaiser? Let me get the phone number for the Medicare number. I'll post it for you. Just give me one moment. And what? I'm not sure. Okay, one moment. Let me get the number for the Medicare. Myra, if you don't mind checking the chat for any new questions that come in while I look for that number.
Absolutely. Let's see. There's a question about what IUI stands for. Oh, and there's a clarification, a step down from IVF. Okay.
I was looking
They
at that
answered
one
the
too.
questions. Yeah.
I was looking at that one too. So, um, in addition, while Marcia is looking up that number for Kaiser Advantage, I wanted to share with the audience that if you look my name up, I'm Nidra Fowler. I'm with the Benefits Division. I did place in the chat a link to the open enrollment seminars. So there you would find on our benefits website the actual recording along with the slide deck. For today's session, it will take a couple of business days. We typically say 3, but we know open enrollment's coming up quick, so we're pretty quick with things right now. And also remind you about if you have questions after the seminar, your benefits ambassadors are accessible to answer questions along with the benefits division. So in the chat, there is a link to the list of benefits ambassadors that you can defer to as well. Okay. Thank you. I see Marcia has replied to Irene with the number for Kaiser Advantage.
I'm not familiar. Myra, are you familiar with San Diego having any other fertility clinics other than Point Loma?
I am not sure. I would have to do a little bit more research on that.
I'm not sure if the A1C is included in the preventative um, services. I think if you are not a diabetic, it is a preventative. But if you are already a diabetic, then it's not preventative because you need to check it on a every 3 months or so. So yeah, so it just depends. We would have to check the glutathione on the formulary. So if you go to kp.org formulary, it'll give you the list of our drugs, so you can check to see if any of your prescriptions are covered under our plans.
Just a public announcement too with everyone who's still on. I'm going to end the recording. However, we are still going to stay on so we can answer questions in the chat because the recording will be posted and we want to make sure we adhere to some privacy situations here because things are coming up in the chat. Okay.